Hi, I'm Representative Alana Rubel, the House Minority Leader here in the Idaho Legislature. Welcome to our Friday House Minority Report, giving you an update on what's happening in your Statehouse this week. And I know you're going to hear from a number of people after me, so stay tuned. I'm just going to touch on a couple points and then they'll cover the rest. One of the big things that happened this week, you've probably heard the first 6 weeks were largely taken up with all these bills that propose to end the declaration of emergency and to strip away the governor's powers. Well, finally one of those passed, House Bill 135. This one did not end the current state of emergency, but what it did was substantially remove the governor's powers over emergency declarations generally. And it said that no emergency declaration could continue for more than 60 days unless it has legislative authority, which is of some concern because we have some declarations out there that have gone for years that enable us to, address emergencies and get funding and do that kind of thing. And the legislature's only in session 3 months a year. So if we have to come in all the time to re-up these emergency declarations, things could get a little crazy around here. But this bill did cause some concerns because it would prohibit the governor from taking any action that would impact people's employment. Well, you can imagine a lot of things, emergencies might require the government to take action that could impact employment. They might have to, if there's a giant nuclear meltdown or a giant fire or something, the governor may have to actually shut down access to entire parts of the state, which would, of course, eliminate people's employment. So I think, that could be barred under this bill. It would prevent the governor from doing things like Governor Little did when he suspended licensing requirements so that retired nurses and doctors could come back and help with overloaded hospitals during COVID. So some worries about this one and how much it'll diminish our ability to respond in future emergencies. There was also a big tax bill introduced by Mike Moyle and Chairman Harris that would it would leave the grocery tax largely in place but would remove the grocery tax credit. So for people on the low end of the income spectrum, it could actually increase the amount of grocery tax they pay. It would reduce the top margin of income tax bracket. But it would, in a couple years, it would result in us losing about $430 million a year in revenue. So this causes us some substantial concern because on an ongoing basis, we're going to have a really hard time funding schools and roads and all the other things we need to do with a giant hit like that to our revenue. So we came up with an alternative plan, and you're going to hear more about that from Representative Nekachea. But some of the points in there, we thought it was really time to have a conversation about full-day kindergarten. This has been one of the top proposals for years on something we need to do to address our child literacy rates and close the gap on some of our general academic attainment rates for kids. It was a top recommendation of our K-12 task force in 2019. We have the money, and we think it's time to really talk about doing that and making full-day kindergarten an option for families who want it around the state. We also think it's important to talk about all the learning loss that's happened under COVID. So many kids have not been in a full-time classroom for a year. We already know that reading scores have dropped 8 to 9% across the state. We don't even have results yet for other tests, but it's probably not going to be pretty, and we're going to need a lot of extra investment in terms of after-school programs, possibly summer programs, to get all these kids up to where they need to be in light of all that COVID time. So those are some things we have going on. I got a bill through the House. I got House Concurrent Resolution 6 passed yesterday, which calls for insurance coverage for kids with serious digestive disorders like seizure disorders and Crohn's disease and eosinophilic esophagitis to cover the medically necessary special formula that's very expensive. So that's on its way to the Senate. Thanks for tuning in, and we'll talk to you next week.
Good afternoon. This is Senator Michelle Stennett, and we're here to talk to you again on Friday about what happened in the Senate this past week. Wanted to point out one of the larger debates in my State Affairs Committee was Senate Bill 1110, which is the effort to try to make the initiative referendum process much more difficult than it is already, which is the most restrictive in the nation as it sits now. This is making everyone gather signatures from all 35 districts at 6%, which means it doubles the districts and it doubles the amount of signatures. And not only just signatures, but it has to come from registered voters. And there's only 2 states that have an initiative process that requires that, so it is a very heavy lift. And it's an effort by the legislative branch to silence the voices of the people, because the one way that voters and the public can tell the legislature what they wish from us, like Medicaid expansion, is through voting and through the initiative process. They argue that they have too little representation in rural counties versus urban counties, which simply isn't true. We are an 80% Republican legislature where all the leadership nearly is rural. All of our leadership as far as the Speaker of the House and even the governor of our state, they all come from rural communities. Almost all of our chairs for our committees and nearly the entire body of the legislature are rural legislators, including myself. So saying that they are underrepresented is simply not true. Also, if you are asking for 35 districts to pass the signature rigor, if one district doesn't, then it holds the other 34 districts hostage. In other words, one district has veto power over an important initiative process over everybody else. And I think that really turns into a very lopsided ability for the people to have a voice. It is unfortunately going to go to the Senate floor. It passed out of committee. And we will be putting information out to everybody about the details of this, but please get a hold of your legislators and tell them that you want your voice heard and not pass this bill.
Hi, I'm Representative Colin Nash. I represent District 16, which is Boise and Garden City. I'm also a member of the House and Senate Joint Finance and Appropriations Committee, which is responsible for setting the state budget, including Medicaid. In the governor's recommendation for the Medicaid budget, he proposed a $30 million cut in state funds and a $118 million cut in state and federal funds, which would be paid for by cuts to provider rates or services for Medicaid recipients. The legislation to give the Department of Health and Welfare authority to make those cuts has stalled, and the governor has since walked back his proposed cut. How we plan on paying for this kind of hole in the budget that the governor's office has created is with federal funds that we anticipate receiving as a result of the federal public health emergency. This increases the federal government's share of our Medicaid costs that they cover. In addition to this, we're still seeing a lot of savings from expanding Medicaid in the state. There's a number of state hospitals that are going to be completely federally funded now, and as well as $30 to $40 million of savings in our overall budget, including about $8 million in savings to the Department of Corrections alone. Medicaid expansion has still been a net positive for the state. There's a lot of people, over 100,000, who are receiving health care who didn't have health insurance before. So rest assured, your Medicaid budget, your Medicaid benefits are safe, and we are doing everything we can to make sure that those holes that the governor's budget request has created, that those are filled, including proposed cost share to the counties. So far, we've seen no legislation to pass on some of those costs to the counties, but as it stands right now, Medicaid, it will be fully funded for fiscal year 2022.
Hi, I'm Representative Lauren Necochea, the House Assistant Minority Leader representing District 19. And this week, our Democratic caucus was so excited to unveil the Idaho Working Families Agenda. It shares our vision of tax and budget solutions to take Idaho into the future. We have three main things it does. We want to provide tax credits for working families. We want to lower property taxes for homeowners and seniors. And third, we need to inject some new investments into our schools. We want to have a balanced approach, facing some extra money, some extra dollars sitting on the bottom line that both puts working families first and takes care of our schools. We have been near the bottom, last or 50th in the nation for education investment for too long, and we need to do better by our students, especially as they struggle with the learning loss due to the challenges of COVID. And we invite you to go to the IDLCC website and learn more about the Idaho Working Families Agenda.